Hi, it's Jonathan again, coming to you from Vets for Pets in Worcester, and I'm going to be talking to you today about some palliative care. Palliative care is obviously quite an emotional subject. It is something where you need to understand what the term is first of all, and what do we mean by palliative care. So palliative care is a condition or a problem you will have, or a situation you get into when you have a patient that has a terminal disease. So we know that the disease is going to be responsible for the reason why we'll decide to euthanize, and we looked at that last week. So if you've got any questions about euthanasia, please refer back to the previous blog, because where I spoke about it in quite detail, and that will give you some pointers about what that involves. The palliative care then phases, that means euthanasia is an option, and it is definitely something that needs to be considered at that time, and you're balancing that against continuing treatment. And hence the thing, you're always in this turmoil because you're always trying to treat, or you're trying to decide, is it time to euthanize the pet. And this is a very delicate process, and it involves a lot of work from the veterinary practice and a lot of work from yourself as the owner of that patient. So we are continuously then evaluating response to treatment. We're evaluating quality of life, and remember I spoke to you previously, we've got those quality of life forms, so if you've got any doubts, then please come down to the practice and pick up one of those quality of life forms. They're quite very useful to help you make a decision where you're at. Obviously then if we've got something where, like it's a tumour, and we've got chemotherapy, or we've using chemotherapy, or the chemotherapy is no longer being effective, we'd be in the palliative care stage, and we're going to be then looking at how do we get the best for our patient using medication. And you do get into a situation where medications themselves can cause side effects, and sometimes you then use medication to treat those side effects, and therefore the medication would go up and up and up, and you'd have more and more medication. So you have to be careful that often the original medication is doing one thing, and then you're using lots of other medications to control the side effects from that medication, as we sometimes see with chemotherapy drugs. Okay, so palliative care is all about giving patients a pain-free, good quality of life, where they're able to continue to do most of their day-to-day things that they'd like to do, i.e. go for a walk, be able to get up and go outside, control of their toileting behaviour, etc. And that's what they're building into those quality of life. And that's really in a nutshell what palliative care is about. It is a high intensity, and you'd always have another consultation check when you're on palliative care. And if you have any questions, and if the vet's not explained to you that you're doing that, you need to say, is this a viable option? Is palliative care a viable option? And then it's a continuous discussion between yourselves and the vet on a visit by visit basis. And each visit, and that can be quite tough, because then we go back to that emotional roller coaster where every single time you're coming into the practice to have a visit, you're thinking, could this be the last visit? Am I going to head towards requiring euthanasia? And that in reality is always a risk, and it is always a factor, and it always needs to be considered when you're talking palliative care. So yeah, it's about just maintaining dignity and maintaining quality, and just working very closely with your veterinary practice. And it's not right for everybody, and it's not right for every patient, so it is important that it is a considered decision. It's not just a, oh yeah, of course we'll do that. It's not one of those. This is something you need to be thinking very clearly, and another good tip is to involve the whole family in this discussion and make certain that you're all in agreement, because what is not good is to have one member who's really keen to keep the treatment going, and the rest of the household or the other member saying, no, I'm not keen, I think it's unfair, and that can lead to disruption in the family as well. So you need to, it's a lot of talking and a lot of discussion. I think that's probably the main thing to get out of this vlog. It's about effective, good communication that improves patient well-being and patient care, and gives them the quality of life that they should be able to have a good day-to-day existence. Okay, so that's all we're going to be talking about on that today. There's quite a lot of other things we're going to talk to you about in the next week or so, but yeah, keep watching, and thanks for your time.